Let me ask you something real quick. When was the last time your doctor told you your blood pressure was high and actually explained what that means for someone your age? Not just handed you a pamphlet, not just added a medication to your list, but sat down and said, here's what this number means for a 68-year-old. Here's what we're actually trying to protect. Here's where we want you to be. For most of you, that conversation never happened. And that's a problem. Because the blood pressure rules that most doctors follow were not written with older adults as the priority. They were written with middle-aged adults in mind. And when you apply those same rules to someone who's 70 or 75 or 80, things get complicated fast. So that's exactly what we're doing today. We're going to go through what these numbers actually mean as you get older, what target makes sense for your age, what happens when blood pressure goes too low, which is something almost nobody warns you about, and what you can do about all of this starting today. Let's get into it. Before we talk numbers, I want to make sure we're on the same page about what blood pressure even is, because a lot of people have been told their numbers for years without anyone ever explaining what's actually going on inside their body. Every time your heart beats, it squeezes and pushes blood out into your arteries. That pumping creates pressure against the artery walls. That's your top number, called systolic pressure. Then your heart rests for a split second between beats. The pressure drops a little. That's your bottom number, diastolic. So 130/80 means 130 during the squeeze, 80 during the rest. Simple enough. But here's where it gets interesting for older adults specifically. As we age, our arteries naturally stiffen up. They lose the elasticity they had when we were younger. And when blood pushes through a stiffer artery, it creates more resistance, which pushes that top number higher. This is not a disease. It's biology. It happens to almost everyone who lives long enough. But it means something important. A blood pressure reading that would concern a doctor in a 40-year-old might be completely expected, and even acceptable, in a 72-year-old. That nuance? Most people never hear it, and it shapes everything else we're going to talk about today. Here's where a lot of the confusion comes from. For a long time, the rule was simple. Below 140/90, you're fine. Above that, you have high blood pressure. Then in 2017, the American Heart Association moved the line. They said 130/80 is the new cutoff for hypertension. Overnight, millions of Americans who were previously told they were fine suddenly had a diagnosis. Doctors started treating more aggressively, more medications, lower targets. And some of that is backed by real evidence. There was a large study called the SPRINT trial that looked at whether pushing systolic blood pressure below 120 was better than keeping it around 140. And the results showed fewer heart attacks in the group with the lower target. Sounds like a clear win, right? Except when they looked closer. Especially at the older adults in that study, the lower target group also had significantly more falls, more dizziness, more fainting, more kidney problems, more hospitalizations from the side effects of the very medications used to get those numbers down. So the benefit came with a real cost. And for older adults, that cost can sometimes outweigh the benefit entirely. That's why many geriatric specialists, doctors who focus specifically on older adults, actually recommend a more relaxed target for seniors. Not ignoring high blood pressure, but not chasing the lowest possible number at any cost either. Which brings us to the actual question you came here for. So what is the right target? For most adults between 65 and 79 who are generally healthy, a systolic pressure, the top number, somewhere between 130 and 140 is considered reasonable by most current guidelines. Some doctors will push for under 130 if you can get there without side effects. Others are comfortable up to 145 depending on your overall health picture. For adults over 80, the thinking shifts again. Several studies now suggest that being too aggressive about lowering blood pressure in that age group can actually cause more harm than it prevents. A systolic target closer to 140 to 150 is often more appropriate for someone in their 80s, especially if they have other health conditions, mobility concerns, or are already on multiple medications. Now, the bottom number, diastolic, needs its own conversation, because this is where a lot of seniors are quietly running into trouble without realizing it. We'll get to that in just a second. But first, one thing I want to be clear about. These are frameworks, not prescriptions. Your personal target depends on whether you've had a stroke or heart attack before, how your kidneys are functioning, what other medications you're taking, how steady you are on your feet, and a number of other things that only your doctor knows about you. The point isn't to memorize a number from a YouTube video and tell your doctor that's where you want to be. The point is to walk into that appointment understanding why the conversation is more nuanced than a single cutoff, and to ask better questions because of it. Speaking of which, let's talk about the thing that almost nobody warns seniors about. Everyone comes in worried about high blood pressure. And yes, it's a serious risk factor for stroke, heart attack, and kidney disease. That concern is completely valid. But for older adults, blood pressure that drops too low is just as dangerous, sometimes more immediately dangerous. And it barely gets mentioned. The most common version of this is called orthostatic hypotension. That's when you stand up from a chair or get out of bed, and your blood pressure drops suddenly before your body has a chance to compensate. You know that dizzy, head-rushing feeling when you get up too fast? That's it. For a younger person, it passes in a few seconds. For an older adult, especially one on blood pressure medication, that drop can be severe enough to cause a fall. Falls are one of the leading causes of serious injury and hospitalization in adults over 65. Hip fractures, head injuries, long recoveries, loss of independence, and a significant portion of those falls trace directly back to blood pressure that's running too low. There's also something called postprandial hypotension, where blood pressure drops after eating because the body sends extra blood to the digestive system. Some older adults feel weak or dizzy after meals for exactly this reason, and they have no idea that's what's happening. So what causes blood pressure to run too low in seniors? Dehydration is a big one. Older adults don't feel thirst as strongly, so they often don't drink enough water throughout the day. Some heart conditions affect pumping strength. And very commonly, it's the medications. Blood pressure drugs, water pills, certain antidepressants, some prostate medications. These can all bring blood pressure down more than intended. If your bottom number is consistently below 60, or if you're regularly dizzy when standing, or if you've had unexplained falls, that is a conversation worth having with your doctor as soon as possible. It may be as simple as adjusting a dose or switching a medication. The big picture here. For seniors, managing blood pressure is not just about pushing numbers down. It's about finding the right range, where you're protected from the risks of too high without being harmed by the risks of too low. That balance is the whole goal. And to find that balance, you need accurate readings, which most people aren't getting. This might be the most practical section of this entire video, because inaccurate readings lead to wrong decisions, and the mistakes people make here are incredibly common. Sit down and rest for at least 5 minutes before you check. Not 5 minutes of sitting while you scroll your phone or talk to someone. 5 minutes of actual quiet. Blood pressure responds to everything: activity, stress, caffeine, even a tense phone call. Checking right after any of those gives you a number that doesn't represent your baseline. Sit with your back supported, feet flat on the floor, legs uncrossed, and rest your arm on a table at roughly the height of your heart. That positioning alone affects the reading by several points. Use a validated upper arm cuff, not a wrist monitor. Wrist monitors are convenient, but significantly less accurate, especially in older adults. And make sure the cuff size fits your arm properly. A cuff that's too small will consistently read high. Take 2 readings about a minute apart and average them. One reading tells you very little. Blood pressure fluctuates constantly, and a single snapshot can be misleading. Check at consistent times, typically morning before you take any medications, and again in the evening. And write the numbers down. A log of 10 to 14 days of readings is far more useful to your doctor than any single number taken in the exam room. That brings up something worth mentioning: white coat hypertension. Some people's blood pressure goes up simply from being in a medical setting. Their home readings are completely normal. Their clinic readings run high. If you're being treated based only on in-office numbers, you may be on more medication than you actually need. Home monitoring, done correctly, gives the full picture. Track it. Bring it. It changes the conversation. I know, lifestyle advice. You've heard it before, but stay with me here because these aren't generic suggestions. For blood pressure specifically, the evidence behind certain lifestyle changes is genuinely strong, and the effects are measurable. Sodium is the biggest one. Most Americans eat 2 to 3 times more sodium than is recommended, and older adults are particularly sensitive to its blood pressure effects. The sneaky part is that most of that sodium doesn't come from a salt shaker. It's in canned soups, packaged bread, deli meats, sauces, restaurant food. Cutting sodium to under 1,500 milligrams a day has been shown in multiple studies to lower systolic pressure by 5 to 10 points in many older adults. That's a real number. The DASH diet, Dietary approaches to stop hypertension takes this further. It's built around vegetables, fruits, whole grains, lean proteins, and low-fat dairy, while cutting back on sodium, red meat, and added sugars. The research on it is decades old and consistently strong. It's not trendy, it just works. Physical activity doesn't need to be intense to help. 30 minutes of comfortable walking 5 days a week lowers systolic blood pressure by an average of 4 to 9 points. If walking is difficult, swimming, chair exercises, or cycling are all solid options. The key is consistency, not intensity. Alcohol deserves a mention. More than 1 drink a day for women and 2 for men consistently raises blood pressure over time. And for seniors on multiple medications, alcohol carries additional risks around interactions and balance that make cutting back worth it. Stress, and I mean the chronic, low-level kind that lives in the background, keeps your nervous system dialed up in a way that raises blood pressure steadily over time. Deep breathing, time outdoors, prayer, a hobby that genuinely absorbs you. These aren't soft suggestions. They have measurable physiological effects. And sleep. Specifically, sleep apnea. Many people don't know they have it. But if you snore heavily or wake up tired despite a full night's sleep, ask your doctor about a sleep study. Untreated sleep apnea is one of the more common and overlooked drivers of high blood pressure in older adults. None of this replaces medication when medication is truly needed, but it works alongside it, and sometimes it works well enough that medication doses can be reduced. If you're on blood pressure medication, or your doctor is considering starting one, there are a few things worth understanding. There are several main classes of these drugs. ACE inhibitors and ARBs are often preferred for people with diabetes or kidney disease because they offer added protection for the kidneys. Calcium channel blockers work well for older adults with high systolic numbers. Thiazide diuretics, water pills, are inexpensive and effective, but require monitoring of potassium and kidney function over time. Beta blockers are generally not the first choice for blood pressure alone, unless there's also a heart condition involved. Now here's the part that matters most for seniors. Many older adults are on 5, 6, 7 medications, and blood pressure drugs don't exist in isolation. They interact with everything else. A drug that drops your pressure a little on its own can drop it a lot when combined with certain other medications. If you haven't had a full medication review recently, where someone looks at everything you're taking together, not just each drug separately, ask for one. A pharmacist or geriatrician can do this. It sometimes uncovers that 2 drugs are working against each other, or that a dose that was set years ago needs to be adjusted for where your health is today. And when your doctor talks about starting or changing a blood pressure medication, it's completely reasonable to ask, given my age and everything else I'm on, what are we actually trying to achieve here? What's the benefit we're expecting? What side effects should I watch for? Is there anything we should try first before adding another medication? That's not pushing back. That's being an informed patient. And a good doctor will welcome those questions. Before we wrap up, a few things that should not be waited on. If your blood pressure reads above 180 on the top number or above 120 on the bottom, especially if you also have a severe headache, vision changes, chest pain, difficulty breathing, or sudden confusion, that is a hypertensive crisis and it needs emergency care. Not a wait and see, not an extra pill. Call 911 or get to an ER. On the other end, if you're regularly dizzy when you stand up, if you've nearly fainted, or if you've had a fall you can't fully explain, don't let that slide. Bring it up at your next appointment, or call sooner if it's happening frequently. That pattern often points to blood pressure that's running too low, and it's correctable. And if your home readings are consistently showing a major upward trend over several weeks despite your current treatment, or they're swinging all over the place day to day, that's worth a call to your doctor. It's data they need to know about. Here's the honest summary. There is no single blood pressure number that's right for every senior. The right target for you depends on your age, your health history, what medications you're on, and what your body can handle. For most people between 65 and 79, somewhere in the 130 to 140 range for the top number is reasonable. For adults over 80, a little higher is often safer. And that bottom number staying above 60 matters more than most people are ever told. Managing this well means staying out of both danger zones, high enough to avoid dizziness and falls, low enough to protect your heart and brain. That balance is the goal. And the tools to get there, better food choices, movement, sleep, accurate home monitoring, smart medication management, are real and they work. If this gave you something useful, share it with someone who needs it. Leave a question in the comments. I read through them, and your question might shape the next video. And if you're not subscribed yet, now's a good time. We cover exactly this kind of thing, the stuff that actually matters for your health as you get older, explained clearly, without the runaround. Take care of yourself. I'll see you in the next one.